Good morning. I'm sorry that I cannot be there with you this morning. For my part of this presentation, I will be reviewing the Return to Learn policy that we wrote. This can be found on the Wayland employee website under policy 8.4.2.1, as you can see on the screen, and the subsequent attachments that are with that policy. Now, my intent today is to outline how the policy will look from the instructor's perspective, although we're certainly going to look at it from a couple of other perspectives as we go. Hopefully, we can answer more questions than we create and help this next semester run smoothly in case we have a student with this need. If you would like a copy of these slides, feel free to email me. I'm happy to share them. But again, all of the information is available on the Wayland employee website. So we developed this policy with two groups of students in mind. The only difference between those two groups is how the communication chain is going to work by which the instructors will be notified. So most of the students who are likely to need this policy are our actual Plainview campus student athletes. We average around 35 concussions per year across all the teams. We can estimate a little under half, maybe around 15 students will need this policy per year. Those athletes will follow one communication path through this process. All other students, including Plainview campus non-athletes, external campus students, Wayland, WBU online students, and any military students from any of those campuses will be using the second path. Again, there's two paths. One is for Plainview campus student athletes, and two is for everyone else. An online instructor teaching a Plainview campus student athlete will communicate through the athletic department because the student falls into that first group. So it's the group they fall into that determines their communication chain. In order to help the students know what is expected of them, the athletic department is supposed to be presenting this to all of their students at their first on-campus meeting in the summer or the fall. In addition, the details of this policy are supposed to be currently posted on the Student Health Services website for all students, especially those online and through external campuses. We are currently working to fill in those gaps where they exist. This is an opt-in policy. Students must opt in order to receive the benefits of the excused absences. The option starts when the student is being diagnosed and provided with treatment recommendations from a physician or that physician's designee. Our athletic trainers and our nurse will be contacting those diagnosing physicians to determine what specific recommendations the physician is requesting. These recommendations will be specific to the person and the symptomatic pattern of the specific injury in question. If you haven't heard from Paula or Corlin yet, and a student comes to you with a complaint of a concussion, it's best just to refer that student to the appropriate medical professional for diagnosis and treatment recommendations. The student can't self-select which phase they're in. That part has to be done through consultation with the appropriate medical professional. So what does it mean to be in the policy? Think of this policy as a short-term accommodation for a student while that student is healing from a minor brain injury. So sitting in class and cognitive work won't delay healing for a sprained ankle, but the brain can't heal effectively or efficiently if it's being overstimulated. So this policy really is just a way of allowing for that healing to occur, and then we catch up after that healing has had an opportunity to occur. Essentially, a student in the Return to Learn policy shall be excused from classes and assignments during this short-term accommodation process. Remember, Wayland policy states that for an excused absence, we are required to allow the student the opportunity to make up that experience, that assignment or that work. So faculty have the option to choose the means of that makeup assignment. However, we're not by contract to hold an excused absence against a student's potential learning opportunities. If the student can heal enough to safely return to academic work in a reasonable amount of time, then that student should be given the opportunity to catch up. If not, other procedures are in place that we will mention later. So in order to ensure that a student is not progressing back to cognitive load too quickly, we developed a stepwise progression that allows a one-day trial to see how the student responds at each phase. Now, the management of that one-day trial process will happen on the diagnostic and the recommendation side on the medical side. But essentially, if the student can complete the workload sufficiently on the first day of that phase, the student will be allowed to progress to the next phase on the next day. A student may not skip multiple phases at once, so only one phase per day. If the situation allows, a student might be able to progress one or two phases over a weekend, but for the most part, that's not going to happen. For some students, we have seen up to a week at some of the different mid-level phases. If a student cannot participate in the current phase without exacerbating the symptoms, the physician might even recommend returning them to a previous phase. But the key here is there are 5 phases. If a student is on phase 1, the student will stay in phase 1 for at least one day. Depending on how that goes, the student may go to phase 2 the next day, or the student may stay in phase 1. So through daily consultation with their medical providers, the student will be able to progress at the rate that is appropriate for that particular student. So the communication should work as follows. There's a lot of words on this slide, so I'm going to skip to a simpler diagram for all of us. Again, the chain of communication is broken into 2 different paths, depending only on whether the student is a Plainview campus student athlete. So for those of you who are looking at this primarily from a course instructor perspective, and that's most of us, note that this top box here for course instructors, there's only 2 arrows here by your box. That's what you need to worry about, okay? All communication to and from you only needs to go through one of these 2 people, either Paula or Coraline, and they will distribute your concerns or your questions as appropriate, and vice versa. So once the university is informed of a student's need for concussion management, either directly from that student or through the student's physician, that information should be forwarded to either the staff athletic trainers, currently organized by Scott Sloan, or Director of Health Services, again, currently that's Coraline Dillard. Starting with the first group, once the athletic trainers have that necessary information, that will typically occur, they'll be gathered on the same day as the injury, they're going to inform the Assistant AD for Academic Support Services, again, Paula Lusk. She will forward that information to the athletic director, to Coraline, the course instructors, the VPAA, Rosemary Pegram, and any others who need to know, depending on the unique needs of that particular student. You can expect to receive an email on the same day or immediate morning after the injury with a statement confirming that the student is in the RTL protocol, which phase that student currently is in, a copy of the RTL phases, and any unique recommendations from the physician. Once that email is sent from Paula, the student is considered to be in the protocol and should be considered excused from classes, even if the student is physically in class one of those days. Again, if the student comes straight to you, the student needs to be referred to the athletic trainers or to Coraline if they want to get excused from any classes or assignments. All other students, those who are not Plainview campus student athletes, they should see their personal physician or perhaps military physician or whatever their circumstances are. That diagnosis or note will be provided to our Director of Health Services, again, Coraline, and she will communicate to the same instructors, academic deans, and others as is appropriate for that student. After the initial diagnosis, the athletic trainers or nurse will be managing the academic side of the care of this student. This will primarily be in the form of reporting when the physician believes the student is ready to move on to the next phase. And that just means that we're going to increase the cognitive workload to some degree. By policy, expect an update on the student either every week or at every prescribed phase change. So if they're moving from phase 2 to phase 3, you should get a note from Paula or Coraline saying so, with all that same information that you saw before. If you haven't heard anything by day 8, please contact either Paula or Corlin. And oftentimes there's a good reason that the information wasn't sent out on day 7, but it should be. But if it's not, please contact them on day 8 and ask, and we'll get that followed up with. Students should only rarely need more than a few days in any particular phase. So if they're in phase 2, really 2 or 3 days is probably the most they'll probably be in there. But sometimes it takes a little bit longer. And again, statistically, most of our concussed students won't need these protections at all. If you have any specific questions about a student in the protocol, start by sending those either to Paula or Corlin. Again, it's the simple communication chain that we try to put together. They will communicate with the appropriate medical provider, perhaps Dr. McClinigan, depends on the question, and then they'll return an answer as soon as they reasonably can. As Mr. Widener, our athletic director, has offered to many of us, again, he's probably already mentioned it this morning, please communicate directly with Paula first. If you don't hear back in a reasonable amount of time for some reason, like maybe she's out of town and we're not aware of that, please email the same question again and just carbon copy to him, and he will follow up and make sure that an answer is forthcoming. He may know why the answer was delayed for some reason. Next, I wanted to walk through a quick review of the 5 phases. I'm not going to read all of these to you. You don't need to know all the details at this point, and not everything is going to apply to every student in every phase. But I wanted to highlight the principles of each phase so you can see what specifically we're going for here. This first phase is complete cognitive rest. The student is to spend as much time asleep as possible. That is the best thing for a student in these earliest phases of a significant concussion. All forms of stimulus, light, sound, spicy foods, we don't always think of it, but fluorescent lights flicker, and the flickering of that light can be very problematic for some students. Physical exercise, even as little as slowly walking down a quiet hallway, can actually exacerbate the symptoms, which can delay healing. Again, the limitations here are dependent on the unique injury to the student. So some students will be more sensitive to certain stimulants in this phase than other stimulants would be. One of the worst things that a student in this phase can do is text. The stimulation of the backlight of the phone, reading the small text, the fine motor control to press the screen buttons reasonably quickly, that combination will cause problems for most concussed people. So we're going to try to avoid that as much as possible. So by opting in, the student is agreeing to stay away from athletics. The student is agreeing to stay away from as many social and extracurricular activities as possible. The student is also expected to avoid electronic stimulation. The staff athletic trainer or the nurse should be checking on these students daily during this phase. During phase 2, we want to introduce cognitive stress while remaining in that same comfortable environment. And by comfortable environment, we just mean an environment that doesn't stimulate symptoms. So if going out in the hallway or a common study area that's quiet is good for the student, then that's fine. That's going to help them heal, so that's good. Once we reach this phase 2, the student is expected to contact the instructor. So at this point, you should hear directly from the students, probably by email if they can tolerate that, but maybe by phone if they can't tolerate email yet. So just be aware of that. We want to provide something that the student can manage at this point in their comfortable environment with minimal active engagement. Try to use only one of the senses. For example, hearing or sight, but not both. So perhaps there is a podcast or YouTube video that the student can listen to that's on the topic that you need them to be thinking about. Do you have an audio recorded class discussion or a lecture on that topic that you can provide them? These are excellent because the student can play and pause as tolerated. Again, reading might be tolerated in short bursts bouts at this point. Again, the mode of delivery is dependent on the symptoms of the student. So you should be provided with that information from those status updates with Paula or Corlin, or you can just talk to the student about it at this point, and they'll tell you what their needs are, and you can provide options for them at this point. Now, again, they're going to be doing short bouts, no more than like 30 minutes at first, see how that goes. If it's symptomatic, then we're not going to go past that at this point. If they can manage it, then maybe we'll do a little bit more. If you receive a status update from Paulo Corlin that a student is in phase 2, and you do not hear from the student within 24 hours, please contact, again, Paulo Corlin, let them know. This was something that they were concerned about in previous discussion. There might be a point of a kid slipping through the cracks. Ultimately, two-way communication is really the way that this policy is going to work so that these kids can get back on track and get back in class. Again, the students should be checking in with their athletic trainers or their nurse every day during this phase. So letting them know if you have questions or concerns is the best way of making sure everybody's on track. Once we move to phase 3, the student should be ready to start returning to the academic learning environment. It's going to start in bursts. So expect the student to come to class, but expect them to only be there for part of the class. So they'll be coming in and out depending on their symptoms. If you know a certain part, like the first 30 minutes, will be more discussion and not much active or stimulating, like chemical odors or students moving around and talking to each other in a big group, then you might recommend that first half, or vice versa. It just kind of depends on how you have your class organized. You don't have to reorganize your class for the one student. Just help your student step into the class and not be overloaded when they get there. The student will be advised to start by attending core and major classes first. Electives will be added next. Anything like a physical activity course will be the last classes added, because we know those are the classes that are most likely to exacerbate these symptoms. And again, the whole purpose of this is to slowly get them back in as tolerated. Even when attending, these classes should be treated as excused absences. If you allow a student to submit work during this phase, like there's an in-class quiz and they happen to be there on that day, you are expected to allow the student to make up that work at a later date. So if they take the in-class quiz and they get 100, that's fine. You can give them credit for that. If they don't, then you're probably going to be expected by the student to allow some sort of a secondary option. If you don't want to do a secondary option, it's probably best if you delay any of those assessment submissions. But if you want to give them a chance to submit something just as rough draft, like for feedback, and you think that would be appropriate for your course assignment, feel free to do that. But again, treat it as an excused absence. Once they've reached phase 4, the student should be able to attend class for the full scheduled time. Students should be allowed to begin making up any missed test work that was missed as the student is able. Total amongst all of the classes, the student cannot make up more than one test per calendar day. Depending on the student, when they first get into phase 4, they may not be ready to do test makeup, so that may have to wait till phase 5, and that's fine. But daily assignments, if there's something like that they want to submit, then this is a good time to start taking that. Again, it's still going to be considered excused, but if it's good work and you and the student are both happy with it, then that's fine. We're going to try to increase the academic workload as tolerated. Again, the student is still not going to practices. The student is still not going to meetings. They may be having short meetings in a comfortable environment with their coaches, but that's it. They are not a part of the athletic department team at that day. You also shouldn't be seeing them like on the sidelines of games or anything like that. The final phase is considered cleared for full academic participation. So once they reach this phase, the student is expected to communicate with the instructors. Again, they've been communicating, but at this point, the plan is, or the expectation is, to create a written plan to complete all missed work. Remember that this policy doesn't mean that students get an easier path to the end of the semester. It just gives them excused absences. They still have to make up the work. So during this discussion, make sure you outline all the missing assignments, including grading criteria, modified due dates that they need to know. I find that it helps to make a running list each day the student is out. So when I'm told the student is on day 1, I make a note in my grade book or where I keep absences. And then every day that they're out for that concussion, I just keep a running total. So when they come back, I have a prepared list, and then we can sit down, have a conversation, and we will negotiate fair deadlines for those expectations. Remember, the student has to catch up in your class, as well as do the current work in your class, and do that for all of their other classes. So the students are essentially taking twice as many credit hours for the next few weeks trying to get caught up as they were before. On top of that, they're also going to start getting back into athletics. And so their time is going to start being split between a lot of things. It's going to be a tough process. So a negotiation is an appropriate word to use here for this process. If a student at this point complains about returning symptoms, please refer them back to the medical provider. Go see your athletic trainer, go talk to the nurse. That probably means the student's not ready for phase 5 yet, and they may need to be pulled back into phase 4 and given more time to heal. During this phase, athletes can start their return to play protocols in the athletic department. So we'll start seeing them back in doing some athletic things at that point, but not until they've reached this phase. They have to be back in the classroom before they can be back in athletics. Note on non-compliant students, this is not something that we expect a lot of, but just in case there is something in play, the student is allowed to count these absences as excused so long as they do their part in good faith. If you see that a student is not complying with their part of the policy, they're going to hang out with friends, you're seeing them in noisy environments while they're on concussion policy, please let Paula or Corlin know as appropriate for that student. Paula or Corlin will communicate that concern to the appropriate people, including Dr. McClinigan. A student may be removed from the protocol, but that's going to happen at the administrative level, and it's not something that's going to happen without a lot of discussion and evidence. Again, just because we see somebody at the brew doesn't mean they're actually violating their particular nuanced plan. So to conclude my part of this presentation, here are a couple of final notes about the Return to Learn policy. If you're working with a student athlete, please feel free to request assistance with proctoring or any other academic support services as needed from the athletic department. They've agreed to help as resources and time allows. In addition, Brandy Heads, Debbie Wiley will be included in these conversations, so those resources are also available. Lastly, there is this 3-week clock on this policy, and everybody's heard of this to some degree. 3 weeks after diagnosis, if a student still needs to continue accommodations for whatever reason, this 3-week clock will trigger a meeting between Dr. McClinigan, Dr. Lusk, either the athletic trainers or Corlin, probably the student, and anybody else that group feels needs to be in that conversation. This 3-week window will disproportionately affect students at external campuses and online, but we can't shorten that window because it's based on human physiology and not the academic calendar. So that 3-week window is kind of set regardless of the length of the semester or where in the semester the injury occurs. But during this meeting, the progression of the student's injury will be weighed with the timing of the semester, and they'll consider what really are the chances that the student can successfully complete this term. So this committee could decide to allow for grades of incomplete. They could apply the medical exigency policy, the incapacitation of a student policy. There are tools in place to help a student if they're not going to be able to get back into the semester in a reasonable amount of time. So there are no guaranteed outcomes of that meeting. It's only that there will be a meeting that is triggered by that 3-week window. So in a best case scenario, the student might only need a few more days to progress, and they'll be in phase 5. And that's ideally what we all want. But that 3-week landmark is a pivotal moment in the student's healing that should indicate the student's likelihood of successfully completing the course. And ultimately, that's what we all really want. So again, I hope that cleared up most of your questions about the policy. I know there are still some out there. If you have any questions in this group discussion that need me to participate with, please, by all means, email me. I'm happy to also send you a copy of these slides if you'd like them. Thank you.